I am deeply concerned about the process, or lack of it, around Clause 191, which was tacked to the end of an unrelated bill via a backbench amendment, with just 46 minutes of backbench debate. Many MPs wanting to speak were unable to do so. This is not a responsible way to make law. As many other noble lords have said, I fear there would be an increase in the number of late-term abortions with no medical supervision whatsoever, particularly as women continue to be able to obtain these pills through the post without an in-person consultation. This came in during the special circumstances of the pandemic, but it has not been rescinded as it should be, even though we are no longer in such a health emergency. Recent figures show that 54,000 women were admitted to NHS hospitals in England for the treatment of complications arising from the use of these abortion pills, a 50% rise from the figures before the pandemic. Analysis of accredited official statistics published by NHS England and the Office for Health Improvement and Disparities shows that 1 in 17 of all women self-managing their abortion at home will subsequently be admitted for hospital treatment. This clause will scarcely improve that. I fear two things. One, that we are creating a modern-day equivalent of backstreet abortion. And second, that it will assist the coercion of women into late terminations by coercive and abusive partners. They could just argue that this is legal now. But this clause would also remove the vital protection for unborn babies mature enough to survive outside of the womb. There is no popular demand or pressure for this form of infanticide. And if the public were made fully aware of this, I'm sure that the great majority would regard this clause not as progressive but barbaric. I am profoundly worried about this clause and will be seeking to address it in committee.
If this becomes law, it would be the biggest change to abortion legislation since the Act was introduced in 1967. As has been said, the permanent extension of the Pills by Post scheme with no requirement for an in-person consultation has made it possible to try to end a pregnancy at any point beyond 24 weeks. Now, at the moment, that's still a criminal offence, and this clause would mean it no longer was, provided only the mother was involved. Now, my lords, it's foreseeable that this in practice will make abortions up to birth more common. It will endanger more women because of the medical risks of termination after 24 weeks. And it will create pressure for a similar decriminalisation for medical practitioners themselves. People will argue, how can it be illegal for a doctor to help with something that is not in itself illegal? Or they will say that doctors need to be able to perform late-term abortions to avoid the risks with terminations at home. It's the beginning of a slippery slope. Now, my lords, there's no demand for this. Polling shows that more than half the public favour keeping abortion after 24 weeks a criminal offence. Only 1% of women support introducing abortion up to birth. And indeed, in passing, 70% of women support a reduction in the time limit from 24 weeks to 20. Now, my lords, the clause would remove one of the few remaining legal protections for the unborn. In our country, if children are born prematurely after 24 weeks, the medical system will do everything it can to save them, and is often successful. Yet this clause will make it possible to try to end the life of a baby after 24 weeks without criminal consequences. It's simply inconsistent, not just with current abortion law, but with current law around maternal and child health more broadly. My lords, this clause had a wholly inadequate couple of hours debate in the Commons. Its proponents really should be embarrassed to legislate on life and death in this fashion. I hope it will get a lot more debate here, and I hope noble lords will reject it.
This clause was passed after only 46 minutes of backbench debate in the other place. It wasn't a manifesto commitment. It constitutes a very significant change to our law on abortion. It carries with it enormous risks to women who might consequently think that aborting a baby up to birth will be safe in these circumstances. doing so without medical help. We're left then in a situation in which your lordships are being asked to legislate for abortion to birth without medical help, because any medical practitioner who helped her would be subject to prosecution. My lords, if this provision is passed, women will think that aborting their own babies will be a safe thing to do simply because it's lawful. This clause is redolent with danger to women. Can the noble Lord the Minister tell us exactly what government thinks how women might seek to end a full-term pregnancy, and how they might be protected against the potentially catastrophic consequences of aborting and delivering a baby without medical help? My lords, this clause is too dangerous to women to remain in the bill.
For abortion, there is an uncomfortable asymmetry. Unlike their mothers, unborn children are helpless and voiceless. We should therefore reject the argument that abortion should be considered purely as a healthcare matter. Yes, of course women's healthcare matters, but to make healthcare the only consideration is to deny a vast and important ethical debate. Both lives in question matter very much. Parliament should not succumb to emotional blackmail. The old saying is that hard cases make bad law.
My Lords, Clause 191 proposes an extremely radical change to abortion law. It was added at report stage in the other place without proper due consideration and only 46 minutes of backbench debate. It's unnecessary, badly drafted and will harm women. We already have one of the most permissive abortion laws in the world. Even David Steele said he never intended the Abortion Act 1967 to enable termination to be treated like a form of contraception. The change in the law is not because there are women who can't get abortions. It's not because it's too difficult to get a doctor to sign off. It's because of an ideological commitment to presenting abortion as a form of health care, like the removal of a tumour. The humanity of the baby in the womb is ignored. A wanted child is a baby and should be protected. An unwanted child is a fetus, an othering word, if ever there was one, and can be removed and disposed of. I simply don't believe the degree to which a mother wants or does not want her baby changes the moral status of the child, and I think we need to have a national conversation about this.
Despite risks to women, this clause intended to transform our societal approach to abortion was appended in a rushed, emotive way in the other House. My Lords, there is a pattern here. Safe access zones around all abortion clinics were also hurriedly appended to the Public Order Act in the Commons. This despite testimonies from women now with grown-up children, whom they were very glad they decided not to terminate after talking to caring and compassionate people outside clinics. Once such measures appear in legislation, they acquire an unassailability on the grounds of care and compassion for women seeking abortions. Clause 191 repeats the same pseudo-virtuous stitch-up. A short discussion in the other House during report stage of a bill that has absolutely nothing to do with abortion, and the assumption that all fair-minded people should agree to it. Those who don't can just be dismissed as reactionaries because abortion is treated as an unlimited good in our topsy-turvy moral universe. Whatever we each individually think about abortion, the laws of this land and a wide range of other considerations are being ignored or twisted out of shape to meet the insatiability of extreme bodily autonomy. Safe access zones sacrificed freedom of speech on that altar. Clause 191 shreds women's criminal responsibility, and with it a vital protection for her against a partner or family member coercing, predating upon her to have a late-term abortion. Bringing about her own late-stage termination of a baby that's been kicking, hiccuping, and otherwise moving in utero will leave a long tail of effect on her life. Decriminalisation is only caring and compassionate in a very narrow and short-term way. This House will discuss ramifications of allowing terminations up to birth, but the only fit place for Clause 191 is the cutting room floor.